right, thank you, Sarah, and thank you to the BRI for inviting me today. And I'm very excited to be here and to talk to you all about my passion, which is implementation science. I'm a director of implementation of the Center for Implementation, which tells you a lot about how much I love implementation. So like something I'm incredibly passionate about. Already done a bio here, so I'm not going to go too much into it. Something that I want you all to know about what I do, though, I like to call myself topic agnostic. The only thing I'm truly an expert at is in implementation science. I'm not an expert in kids rehab. I'm not an expert in cancer screening or cancer management. I don't have a clinical area of focus. I truly do focus specifically on implementation. And also because of the work we do at the Center for Implementation, one thing that I've been privileged to be able to do is work with many, many different kinds of people in the system who work at different levels of the system. So I was just talking to Sarah about the kind of work that I was doing. So just to give you an example of the experience that I have currently, I'm working with a group out in the state of California who's implementing social and emotional learning into all California schools statewide. So we're doing we're the statewide implementation support for that work. At the same time, I'm also working with a group who is trying to reduce addiction stigma across the US nationally. At the same time, I'm also working with the WHO currently to develop some implementation guidance around their updated PPH guidelines, or their postpartum hemorrhage guidelines. So that's just like a cross-section of the kind of work we do. It spans a lot of different areas, and it works on a lot of different systems. And because of that, a lot of what I'm going to talk about is very high-level, kind of, just like a bird's eye view, because I'm not a specific expert in a specific topic area, other than implementation. If you don't know about the Center for Implementation, what we do is we are a social enterprise. We train, support, empower professionals across the world, really. We work globally to use evidence-informed approaches to maximize their impact. And so we provide implementation support. So I gave you an example of that with what we're doing in California. We have long-term partnerships for research and practice and implementation. And we also do workshops, we have courses, we train people on how to use implementation science in their practice. And so I always think this is a really funny image. I don't know, I laugh every time I see it, but it's a good description or a depiction of where TCI sees themselves, or where we see ourselves in the world. So there's a science of implementation, and I'm going to go into what that means in case you're wondering what implementation science is. And we generate this amazing knowledge about how to implement from implementation science. But one thing that we recognize is that there are people who have to do implementation on a day-to-day basis in their clinical work, in their public health work, and they don't have access to implementation science to help inform how they're going to implement well. And so we recognize this gap, and what we want to do is take the science of implementation and make it practical and accessible to the people who actually have to do the implementation work day in and day out. The other piece that we've recognized is that there are many researchers new to this space, and they also want practical, digestible information on how they can use implementation science in their implementation research work. So we work with researchers and practitioners very closely to support them to use implementation science in their work. We also have made it a goal of ours to take practice needs and implementation and lift them up so that researchers are able to research what the biggest problems are in implementation practice, so that we have some evidence and some solutions that can be tested using research. So over the next, let's say 40 minutes or so, I'm going to talk about how we can understand how implementation science can support your work. We're going to explore questions to help you think through inclusiveness, readiness, and mental models related to equity and implementation, because that's the meat of my talk today. Not just how we implement, but how we can do it with an equity focus, and to deeply reflect on what it means to plan for and implement equitably. Okay, so before I start, how many people are familiar? We're going to do like old school raise of hands. How many people are familiar with the term implementation science? Okay, so we have a lot of people in the room. How many people, and this is a psychologically safe space, so how many people would say that they feel proficient in implementation science? Okay, so we have a few. Obviously, the new scientists should feel like they're proficient in implementation science. Okay, how many people feel like they've heard of it, but they don't know too much about it? Okay, so there's a majority of people in the room. Okay, so what I'm going to do is start off with a little bit of an overview of what implementation science is. I like to do this because we should all be on the same ground, we'll all have the same foundation for this talk. So I want everybody to be on the same page before I keep talking about and digging into equity in implementation science. If I'm going to ask you questions that relate to equity in implementation science, it helps for us all to have a clear understanding of what implementation science is. So, change is hard. We know change is hard, right? We try to impact systems by changing things in the systems, and we know that it's really hard to do this. And so why am I talking about change? It's because implementation at its core is about change. If you think about anything that you implement, whether it's a product, so I was walking around the posters, right? People have different products, different training tools, different devices, for example. You're implementing these things, and what you're asking people to do when you're implementing them is to do something differently. Whether it's in their practice, whether it's in their daily schedules, whether it's a policy that's dictating how people are supposed to do something differently, at the core of implementation is change. And that's why we know that just saying, hey, we have this thing, now do it, doesn't work. It's because you have to manage people through change, and you have to facilitate change in order to implement well. So this is where implementation science comes in. We have fields like change management. We have fields like quality improvement. Implementation science has a very specific focus on mechanisms of change and how those specific mechanisms of change can help us implement a lot better. So I feel like if you're doing QI, if you're into change management, implementation science could be a really nice complement to what you're already doing. It doesn't have to replace it, but it could be a really, really nice complement to what you're already doing. So the kinds of things that we do in implementation science, we select implementation strategies, we use tested implementation processes, we understand factors that promote good adoption, implementation, and sustainability, and we understand mechanisms of spread and scale. So that's very, very high level. There's a lot more that goes into it, but at its core, those are the kinds of things you're doing in implementation science. The other thing that I want to point out, so if you're interested in implementation science and you start delving into the research and literature on it, people in the field imagine implementation science as this umbrella term for implementation research and implementation practice. So it's possible that you could be under the umbrella of implementation science. You are using implementation science to do research and to generate more evidence that feeds into the science of implementation. And you could also be in practice. So you are the implementer and you're using implementation science to strengthen your own practice. So those two things are true under the umbrella of implementation science. So let's go through an example of implementation research. In a standard trial, you have an intervention, let's say a drug of some sort, and you're doing a research study, let's say an RCT, and what you're trying to look at is the efficacy or effectiveness of the intervention. In an implementation research study, you have an intervention, but instead of understanding the effectiveness or efficacy of that intervention, you want to know how best to implement it. So let's say you have this drug, and in order for this drug to be effective, prescribers have to appropriately prescribe it, and you have patients or people who are taking the drugs have to do that according to the suggested regimen, right? So they have to adhere to that drug. What strategies are you using to help promote adherence and appropriate prescribing? Are you educating people? Are there prompts and reminders? Is there audit and feedback? Are there, opinion leaders? Are there policies you're putting in place? What is it that you're doing to help implement or trying to boost adherence and prescribing behaviors? You, in an implementation research trial, are testing those strategies to see if they work, to see if it promotes adherence and good prescribing behaviors, which is essentially, hopefully, gets to the effectiveness of the drug itself because those are being adhered to, right? And so what you're trying to do in an implementation research trial is say, hey, do these strategies work? Are we able to implement well and change people's behaviors according to evidence and theory and the trial that we're doing in order to understand this behavior change? And so the other thing I'm going to show you here, so I didn't say this, but I have another hat. that I wear. I'm the scientific review lead for implementation research at the Gates Foundation, and we have started, it's like a brand new there, right? Like they're like, what is implementation science? Let's start doing implementation science more. And so we have like a classification system for Gates funded projects that come through the pipeline that we review. And this is based on, so the people who are proficient in implementation science, the hybrid implementation effectiveness trials. So this is a classification system for how much implementation research is actually in a trial. And it's possible to do an effectiveness trial combined with an implementation trial. And so we didn't want to use like hybrid type 1 and 2. We wanted to use different terminology. So internally we use this classification system where IR Light is an effectiveness trial. Primarily, you want to understand clinical effectiveness, and then secondarily, you're looking at some implementation outcomes. So you're asking some preliminary questions about implementation. When you move up the spectrum, you have IR balanced, which means that you have co-primary aims. Effectiveness and implementation, you're balancing both, you're interested in both. Now, when you start moving up the spectrum, you have IR dominant or a type 3 hybrid trial. And so here you're primarily looking at the effectiveness of implementation strategies. At this point, you've probably established effectiveness of the intervention. And so you know it's safe and effective. And at this point, you're like, okay, I have most of my questions are around implementation. And you might have some outstanding questions about effectiveness, like does it work in every context? Does it work for every population? But you're not asking, is it effective in general by this time? And then you might have a full implementation research study. You're not even looking at the effectiveness of the intervention. You know it's effective. You just want to understand how it's going to be best implemented. And so why am I showing this to you? It's because I think that no matter what, you don't have to be a full implementation research, committed scientist. Everybody to some degree probably touches implementation science in some way. You might have a small component in your study, or you could be fully devoted to understanding implementation. And it's possible to have this one small component, and because of that, it helps to understand implementation science and how it can benefit you, because you are including some implementation research questions in your studies. How else can implementation science touch you? If you're in practice, right? If you have a clinician hat, you probably understand things are implemented all the time. And wouldn't it be useful if you knew the theories, models, frameworks, and approaches that can help you in your practice, in your planning for implementation, so you know how best to sustain things, how to scale things. Why not use the science of implementation in your own practice? So this is kind of my message to you. Obviously, I'm biased, right? And so, but implementation touches us all in different ways. Whether you are wearing a practice hat or whether you're wearing a research hat, maybe you don't want to be fully devoted to implementation research, but you're probably going to be able to use it, because I can't even think of like one person who's never implemented anything in their life, right? So it helps to understand what implementation is and how we can best do it. So I'm going to skip over these slides really quickly just because of time. But the purpose of these slides is really just to show, is to show you that we have different activities that we can do when we are doing implementation science. Some of the key things that people are thinking about is how we can select implementation strategies using theory and evidence. And that's what this pathway depicts, is how we can select implementation strategies. This is something you would do in your formative research. This is something you do prior to implementation, and sometimes during the implementation process if you're doing cycles of implementation. But understanding how to select strategies using theory and evidence is a key part of implementation science. Understanding things like how to build teams and implementation infrastructure, how to assess and address readiness and context, how to understand adaptations and sustainability, how to monitor implementation and understand cycles of implementation, how you plan for those, and also how you evaluate implementation. So these are all competencies that are related to implementation science. And finally, I do want to say that there is a growing emphasis on relationships in implementation science, and we're going to talk about this in a bit, but if you are new to the fields and you're looking for research areas, relationships is a huge part of it, because I'm about to present a slide about how relationships are truly the core of what we do in implementation. So with that, okay, so we're going to get into the heart of the talk, which is we all have a common understanding. How are you feeling about that? Are we good? Yeah? I'm seeing some nods. Okay, so we're feeling like we have a common understanding of what implementation science is. But really the question is, how do we do this in equitable and just ways? And so this is a question that we've been grappling with at the Center for Implementation. A few years ago, we actually went to the literature to see how people are doing this and what they've done, right? So we did a scoping review. We looked at frameworks in implementation science to understand how people are conceptualizing equity as part of the process. One thing that we found that was quite clear is that people often look at equity and outcomes, right? So it's like, okay, well, I've done this research study and I want to do a sub-analysis or subgroup analysis, or I want to do this by sex or gender, I want to do it by ability level, I want to do it by race, right? And so you're slicing and dicing the data. Not a ton on how we do implementation equitably. And when there was a lot on that, people were all over the place. They were like talking about equity in all these different ways. And so we didn't get to what we thought we were going to get to. We ended up doing a sense-making exercise, and we came up with what we call our equity iceberg. We love iceberg models. So people who do who are into systems change, there's also a systems change iceberg model. We kind of borrowed it from there. And so what we found is that people were talking about equity in terms of actions, and that's at the tip of the iceberg. And actions include the implementation processes that we take on. So for example, if you're doing a barriers and facilitators assessment, if you're assessing readiness, if you're selecting strategies, those are all part of implementation processes. And there are ways to do those processes in very equitable ways. And then what's really driving all of that is equity in relationships. Because as I said, you can't really do implementation without working with other people. And so, as you're doing barriers and facilitators assessments and readiness assessments, you have to work with other people to do this. And how do you involve people in just and equitable ways? How do you balance trust and balance power and cultivate trust? What are the things that you're doing relationship-wise to help you meet your goals when it comes to those implementation actions? And then underneath all of that are the systems and structures that we work and live in. So we're in a research institute, which is governed by a set of structures, policies, by the way the research is conducted overall, how we publish, how we get positions in a research institute, and that drives the kinds of relationships that you have, and also what you think of or how you conduct implementation. And then underneath the surface are our mental models. This is our worldviews, our values, our beliefs, which truly drive the systems and structures and how those things are set up, and also how we manifest our relationships and our processes. And so people were really thinking about equity in all these different ways, which is why it was so confusing to us. We were like, okay, well, what are they talking about when they're like asking these questions about equity? And when we did this sense-making exercise, it made so much more sense. Some people were going to very deep places, like what are the underlying beliefs that are driving this? Some people were asking questions like, do we need to reckon with ourselves as a field to understand how we're perpetuating inequities as a field? And other people were like, how can we do processes and build relationships a lot better? And so what we did with this information was we were hoping to get to a point where we had very specific strategies that we could use to help recommend strategies to people to bolster equity in their work. And we didn't really get to that place. What we got to was a list of what we call our equity guiding questions. These are questions that help people consider equity at any step of implementation and all along that iceberg. And so it's kind of a massive document, but it really helps you think through, okay, if I have this implementation step, how can I bolster equity in that step? If I'm thinking about relationships, how can I dig deeper into those relationships? if I'm really prepared to question the systems and structures that we live in and work in, what are the key guiding questions there that can help us really dig into how we can bolster equity in our systems and structures? I recognize that we don't have a lot of time today to go over all those. There's probably 100+ questions in there, so I'm not going to show them all to you. But I picked 3 areas that I thought might be of interest to you. The first one is the importance of equitable relationships. And before lunch, I got a chance to catch that presentation, and I think a lot of what those presenters had presented is really relevant here. The readiness dilemma and reflecting on mental models. So that's what we're going to be talking about today. How are we feeling right now? We good? Yeah? Okay. Awesome. Okay. So first thing, the importance of equitable relationships. And so, as I said before, implementation is relational. It's a social process. And I don't think that people specifically name it as a social process, but that's what it is. It's all about interacting. There's no lone horse coming in and implementing something. It's always done in teams. It's always done with other people. And so you have to, because it relies on relationships, you have to focus on relationships. And I love telling this story. Some people find it strange and some people laugh at it. So I'm just gonna tell this story. The California group I'm working with, so we're working with county offices of education in California. And so they have an invitation-only relationship with their districts and schools. So they have no authority, right? They have to be invited in. And they're trying to implement or support implementation of social and emotional learning. So they have to show up and they have to say, hey, you should implement social and emotional learning, and the school's allowed to shut their door to them, right? And so I'm supporting these county offices, and there's this one person in San Diego who says, I keep reaching out to the principal of the school and, asking for a meeting. He never wants to talk about social and emotional learning. And I said to her, I was like, you know what? Why don't you just ask him what he needs rather than say, I'm going to show up and talk to you about social and emotional learning? So she emailed him and said, hey, I'm wondering what's going on. What do you need from me? And he said, can you attend an event that we're having in the community? So she attends this event, and then she sends me an email debrief after. And she says, I showed up to the event, and I shredded chicken for tacos the whole time. And then the next day, the principal said, hey, that social and emotional learning thing, let's talk about it now. And so she said something, and the reason I'm telling the story is she said, it felt like it wasn't work, and I realized after it was all of the work. And that to me was like a light bulb moment where it's like shredding chicken for tacos feels like this insignificant thing that you spend time doing, but that's the you're like, what do you need? How do I show up for you? And that's what the principal needed at the time, and she showed up, and then he was like, let's talk about implementation now, right? And so that's just the lesson, right? Sometimes you just show up and you are trying to be helpful and not just somebody who's trying to implement something. And so, relationships, it's part of the work. And so how do we do this in equitable ways? I think many people who give equity talks talk about diversity. You need to have diversity of people. I'm not going to go over those points because we all know that. You should have diversity of people, capabilities, different races, different, experiences in life. Those should all be represented. I really like this specific diagram, though, because I think it talks about diversity in a different way, which is diversity of voice. How many different voices do you have at the table when you are trying to plan for implementation and do something differently? And so this is this beautiful diagram that shows that when we have an ecosystem for change, we need to have all those voices at the table equally so that everybody can help one another and can plan together to foster that change. So let's say voice of capability. You can tell my eyes are getting old because I can't read that. So people with the resources to contribute, people who have specialist knowledge, skills, and tools, that's the voice of capability. We have voices of experience, like we have parents. We have that youth advisory council, right? Like these are all voices of experience, so people who actually experience the problem. There are people who are directly affected by the problem, and we want to have their voices at the table. We have voices of intent, people with passion or motivation to take action. and people with authority or a mandate to drive change. And then we also have voices of connection, so people who can broker and facilitate or coordinate. And we also have people who can connect with diverse communities. And the reason why I wanted to show this is because often when we're asking who's at the table, who's not at the table, and why, especially in a research setting, I feel like we tend to over-rely on the voices of capability. We're starting to fold in the voices of experience. We might have some voices of intent, and we might start bringing in voices of connection, but all of those are not equally weighted. You know who's driving the car, right? You know who's in charge here, right? It's often the voices of capability. And the reason why I like this diagram is because it doesn't show you any kind of like weight or hierarchy. All of those are really important to making change. If you want to make sure that you are implementing well, you have to have a voice of connection. If you want to make sure that you're implementing something that's meaningful, you have to have a voice of experience. If you want to drive people and motivate people, you have to have a voice of intent. And of course, you have to have people with capability to do all of the work. And those are all equally important in this ecosystem for change. Some additional questions to consider when we're thinking about equity. And so there's a long list of questions here, and I pulled a few that I thought, my bias, I find interesting, and I'm hoping that you find interesting too. How did the convener come to adopt the role of convener, and what impact does this person or group have on equity? And so when you're thinking about bringing people together, anytime you're trying to do implementation work, there's often a group, a person, or a few groups of people who are bringing other people together to do the work. So think about your role as a researcher, for example. If you get funding, you are the convener of people to write a grant. Then you get the funding, and then you convene people to do the work. And so what does that say? Like, if you are the person who's bringing people together all the time because you're getting the money for it, because you have this prestigious, appointment at a research institute, and you're trying to bring other people into the fold, there may be some more hidden or invisible forms of power that you're leveraging because of the fact that you are the convener all the time. And so the work of the convener is to bring people together, but also to distribute that power so that those power dynamics aren't always felt throughout your implementation work. So that's something to think about when you are always in a convener role. It's a privilege to be in that role, and it's also a privilege to distribute the power that you do have as a convener. And this leads to the second question, which is what types of power, values, beliefs, and biases do people have? And so it's helpful to recognize that people have different levels of power, that people have values and beliefs that they bring to the table and certain biases. And often when we're trying to work in equity and implementation, we have to talk about these. Do we have common values? What are our common beliefs? Despite our differences, how do we go forward together? And often connection happens through values and beliefs and through distribution of power. This relates to the third question. Do partners have the power and voice to determine how they wish to contribute? Or did we set a role for them in advance? Did we say, you should contribute by doing this thing? Right? Are people able to say, no, I want to contribute in this way because this is the best way I can contribute. This is my power I have to give. And so we have to think about that. What historical, structural, social, and political determinants might impact people's willingness or ability to engage fully on a team? Not everybody, so you might invite people to the table. If people don't show up, it's helpful to wonder why and ask them why. There's sometimes historical, like if you think about relationships between researchers and communities in the past, it's not always positive, right? And so that's carried forward, and you have to think about that. You have to have transparency about that. It's helpful to dig into those issues. And finally, what types of spaces are people being convened in to promote equitable participation? I will say this is probably one of the first hybrid events I've been to in a long time. And so I'm going to applaud you for that, right? Because this is an equitable space. Like, people who are not able to show up in person are able to watch it virtually. And I actually questioned, I was talking to Sarah about this conference I was just at in Denver. It's the Society for Implementation Research Conference. And they used to be hybrid before, and they stopped being hybrid. And I was like, and I actually questioned the organizers because they had a breakout session on equity and implementation. And I was like, but you removed the hybrid option. And they're like, oh, the logistics and the cost, et cetera. And I said, well, not everybody has the ability to come in person. Some people have chronic diseases and can't come in person. Some people don't have the resources to come in person. They can't pay for the flight, right? They're not covered. So but they want to participate. Why should they not get access to this knowledge? And so the spaces that we create for convening people tell a tale of who we want included and who we don't want included. And I think that's very, very important. This has shown up over and over again in the implementation work that I've done in different ways. So just be mindful that not all spaces are accessible, and not all spaces are safe for people as well. Okay, so a really quick reflection. I see that we're coming towards the end of our time soon, so I'm gonna fly through this. We're gonna do this old school. So we're gonna put up hands, right? Okay, so reflect about the 4 areas and projects that you've worked on so far. So we're talking about the voices of connection, of intent, of experience and capability. Which voices seem to be missed the most often? So reflect on your work. So when you're thinking about the voices of intent in your work, have these been missed the most often? Put up your hand if this is true. What about voices of connection? Are these missed the most often? Okay. I'm seeing hands go up. Voice of experience. Yeah. And what about voice of capability? Oh, no one someone tentatively put up their hand. but not committed to that. You're like, right? Okay, so it's a good reflection. Who are we missing at the table? That was just a quick reflection here. Okay, so now I'm going to go into another topic that I think is super, super interesting. I call it the readiness dilemma. How many people have measured or assessed readiness prior to implementation before? So I have a few people, the people who are into implementation research, yes, you've done it before. Okay, what do we tend to do when we are measuring readiness? We are usually doing it before we start a research project, and we're saying, okay, well, we want to make sure that people are prepared to do this, right? You want to make sure that the conditions are right, that they're well equipped, that they have the right staffing, because we want to make sure that we are measuring effectiveness of the intervention, and we don't want all these different confounding factors, like things that people are not prepared for, to affect our research study. And so often we use back in the past, we used to use readiness assessments to be able to select sites for implementation. Consider what this does to less ready sites. So if you're not ready, that means you're at a disadvantage in some way, shape, or form. There might be many reasons why you're not ready. And if you're continually not selected to implement some new, hot product or some new innovation, that means you're always going to be continually in a disadvantage. And so should we be moving from a ready or not kind of mindset to let's meet people where they're at? And this is something that we call in implementation science readiness building. And this is so if you're, again, new to research in implementation science and you want a topic, readiness building is a huge place that people are thinking about, because we can build readiness. And so this is something that we have to think about. If there are people who are not as ready, can we build their readiness rather than not select them? Can we incorporate readiness building into our implementation research projects so that they have an equal opportunity to be able to try to implement something, and they also reap the advantages of working with researchers, of being able to use that product so that they're not continually at a disadvantage? So this is something, just a little seed that I wanted to plant here, because I think it's really important. And so we have some questions in our equity guiding questions that relate to this. Who's deciding who's ready or not? I think that's important, right? Is it the people who are implementing who are deciding, or is it you? Is it somebody else who's deciding you're not ready? Have you considered the equity-related impacts of deciding not to move forward with settings that are considered not ready by your standards? And have you considered shifting from a ready or not mindset to meeting people where they're at? So this is one of my favorite parts of it, and I think this has been like a aha moment for a lot of people, where they're like, ooh, do we perpetuate inequity because we choose not to implement in ready or unready sites? Reflection. How often have you thought about readiness building as part of your own research work? So again, safe space. Have you not at all thought about it? Put up your hand. Oh, so people have thought about it? Okay. Have you rarely thought about it? Okay, we have a few hands. Sometimes. You thought about readiness and building sometimes? Oh, awesome. Often? Great. And very often? Ooh, okay, so we have to talk. Right. That's good, right? So if you've thought about readiness building, that's amazing. And also, if we're talking about systems and structures that drive how we implement, funding agencies do not give you the right amount of time to be able to build readiness. And there's a huge push in implementation science in the field to advocate to funding agencies to say, hey, people need lead up time. They need to build relationships. They need to build readiness, or else we're going to continually perpetuate inequities. So let's do this. So if there's a system or structure that we're thinking about changing, it's how we fund implementation research studies. The final thing that I want to talk about is reflecting on mental models and why this is so important as in implementation research and when you're thinking about equity in implementation research. So mental models are the way that we think about the world or the way that we think things are going to happen. So the best example that I could think of, particularly this week, was how we think government works is a mental model, right? And everybody thinks about it in different ways because they have different experiences, they have different beliefs, they have different worldviews, and they carry with them different values. And so I might think, okay, well, like I love, this is so weird, but I love taxes. I do, right? and I believe that the government should tax us because I believe in public programs, right? But not everybody believes that. They believe in small government, and that's how government should work. And those beliefs are driven by your experiences, your values, your beliefs, and your worldviews. And this is really important because mental models drive a lot of how we implement. And here's an example. The theories, so if you're going to be going and reading about implementation science now and going to all these theories and frameworks and models, you're going to notice this language like intervening on, pushing out. What's the mental model there of implementation? That there is like a person who's an expert who is taking something and intervening on another population of people, or pushing something to them as if people who have to adopt something are passive recipients of it. That's what you mean when you say things like that. And so it's helpful, and this is my call to action, to be critical of it, to question how we frame this. This came up earlier, how we frame things, how we word things. What kinds of ideas are we perpetuating through this kind of mental model and that we represent in our theories, models, and frameworks. And so things that we've done at the Center for Implementation is we've literally redrawn implementation science frameworks to center people who are most affected by the problem, to make them not passive recipients of it. We've changed language, and I encourage you to do the same thing. If you're going to use an implementation science framework and it doesn't represent equity, change the language, change the framing. Other types of language that can reflect mental models, and I hear this all the time when people are implementing things, they're using language like, well, they must do this, they need to, we have to, they should, they have to change, you should change. But, that's not necessarily the kind of message that we want to give because that reflects, again, an intervening on, pushing out mental model. You could use language like consider, think about, you can do this. That shows that you can participate. It's your choice to participate in this process. Come along for the ride, not that people are doing something to you. Let me do this. Okay, so we have questions in our equity guiding questions about exploring mental models. And so these are an example or a few of the questions we have that dig deep into values. And the usefulness of these questions are things that you could bring to your own team to actually have meaningful conversations about things like values, worldviews, beliefs, and experiences. So for example, what are our core values? What informs them? Why do we hold them? And how important is it to maintain these values and beliefs that we have? And what needs to be done to either uphold or do we need to change them? So do we have to change how we're thinking about things and what we value when we are approaching this work? And I've used these questions before in my work, and some people have even coined the phrase values-based implementation. And it's been quite powerful to articulate the values that underpin this work because people connect to the underlying values of the work. So some key takeaways, we're about to wrap up. Some key takeaways here. Use the equity iceberg and the guiding questions, not because we produced it, but just as something that I think can help you get deeper and deeper into equity. Because often, like we think about this surface kind of level, and it's helpful to go into that place where you're asking about those core deep values and beliefs and understanding how they may drive systems and structures, and also how they perpetuate certain kinds of relationships and implementation processes. So another link to the equity guiding questions. Please access them. They're for free. Download them. Use them in your own work. On our website, we also have so many other resources if you're new to implementation science to help introduce you to the science of implementation, and to help navigate you to those different theories and models and frameworks that I talked about. And that's it. All right. Thank you so much. So I think we have time for Q&A. And Sarah, are you going to? Yeah.
Thanks, Sobia, so much for such a thoughtful talk. I really, really enjoyed that. So we will take some questions. Is there someone with a mic, or I'm happy to?
Thanks. Really interesting presentation. I'm looking through it through the lens as an IT person, not a researcher here, and how it compares to project management, whether waterfall or agile. Is that all sort of a subset of implementation science, or are they just sort of like cousins?
I think they're cousins, and I often say that implementation science is a hybrid science. And so, like, when you come to the field, people have asked, well, how is this different from change management? How is this different from project management? And so what I like to say is that, like, this is between us and the people who are viewing virtually. People who are like hardcore implementation scientists like to think it's like a brand new field, and it's not really. It's borrowed from many, many different schools of thought, things that people have been doing for decades. It's just putting it in a different way and trying to understand the underlying mechanisms of change. And so project management is part of it, to articulate plans and to outline how we think things are going to happen. But underlying implementation science is understanding the science and the theory of how to perpetuate change at individual, organizational, and systems levels. And so I would say they're complementary. And I say that implementation science is also complementary to things like QI, like quality improvement, to change management, to systems change. And so if you're going to be truly in this space, it does help to understand all of those things. In political science, like we borrow political theory all the time. So yeah. Yes, we have some.
I was nervous to ask this question, but based on what you just said, I think we're going to be fine.
Okay.
So one of the areas that I think gets bored on a lot is social psychology, right? A lot of these things are a mobilization of social psychology. We've known about some of these biases for a really long time. So I've always been kind of shocked that intervention or conceptualization of cognitive biases I haven't seen them play out in some of these implementation science frameworks. Like, we know these are ingrained. We know they're ingrained for many reasons and many reactions. Have you seen any movement towards that? Because, I'm just wondering about that.
There is, and so what we're doing a lot right now in implementation science is borrowing from psychology. We're also borrowing from behavioral economics to understand how to change behavior. So anything that people have traditions of understanding how to mobilize and change behavior. It's like borrowing that, and how do we take that and put this into implementation science or implementation plans is essentially what we're trying to do. How do we use that information to be able to select strategies to help overcome some of these barriers and facilitators that we see? And so I would say there's more openness. Like, again, people used to think that it was like a brand new field, but more openness to borrowing from what we already know and traditions of what we already know to incorporate into the science of implementation. So my short answer is yes, people are moving towards that.
Great. No, that's really awesome.
Hi, thank you so much for the thought-provoking presentation. I wanted to clarify the 4 voices that you mentioned and how it's important to have representation from all 4. But sometimes, like, there are cases where the voices overlap. So for someone with lived experience, perhaps that's what drove them to have the intention, the passion to pursue the research, or someone with capability might also have the connections. So are you saying that there should be independent voices from all four, or does the overlap kind of also lead to any conflicts of interest or things like that?
I think you brought up a really key point, which is like they're not mutually exclusive. Like they can overlap, and even when I did self-reflection of where I tend to fall, I could fall in multiple categories. And I think the message truly is just like you shouldn't only be leveraging certain kinds of voices. And so if your go-to is always voice of capability, then like it's not going to perpetuate a very inclusive environment where there's diversity of opinion. If there are people who are able to inhabit different roles, that's really strong. Like as you're saying, like for example, like patient advocates often also are voices of intent and can be voices of connection. I used to work in overdose prevention, and we used to use people who are like both passionate about this work and are also brokers to communities to be able to get more people to participate in our implementation work. So it's okay to have overlapping roles. We just want to make sure we don't diminish the kinds of roles people have in favor of other kind of voices.
That makes sense, thank you.
Yeah.
I also have another question
Yeah.
about how you mentioned that you're not an expert in like clinical practice or the different projects that you're invited to work on. So in those cases, how does your experience help those teams, or how does it compare with people who have specific experience in implementing like a new drug, for instance, like as someone who doesn't necessarily have the background in that field?
A lot of the work, and maybe this is also a bias of mine, this is why I come at things more collaboratively, because any work that I do is always in high collaboration with other people, because I rely on their experience and their expertise, understanding where I have gaps in my own experience and expertise. And so, like, the work that I do is often like, hey, this is what I bring to the table, this is what I can contribute, and this is what I'm hoping you can contribute, and what would you like to contribute? And we have to, like, kind of form these protocols and these ways of working together in order to make sure that we're able to both contribute our expertise to these projects. Does that answer your question?
Yeah, like the collaborative aspect, yeah.
It has to be highly collaborative, because I basically rely on other people to fill in gaps. And so an example is, like, I didn't come into this work on social and emotional learning being a social and emotional learning expert. I've learned along the way. But I think it's really important for other people to co-lead so that they bring their expertise. And when there are specific implementation questions or problems, I'm there to provide my expertise. So it's truly like many people walking together and nobody really leading the way.
That makes sense, thank you.
Yeah. Yes.
Thank you for the talk. I just had a quick question. You've said that for implementation research, you've collaborated with a lot of different industries, a lot of different professionals. So are there any universal boundaries that you've noticed come up in all these different fields? And if so, are they more at the individual and personal level, or more at the societal and institutional level?
Do you mean like common challenges,
Yeah,
barriers,
common
and facilitators?
challenges
I would
barriers.
say, you know what? I'd say that they're multi-level, like, and they are common. And it's really interesting, like having this kind of bird's eye view. Often when you're working in one field, you're like, okay, well, I understand in this hospital setting, people have these incredible challenges, right? And because you're working in this hospital setting, you don't understand that other people who may not even be working in a hospital setting still have the same challenges. So for example, burnout. Burnout has come up as like a huge, huge challenge across schools, across hospital settings, across public health settings. I was working with clinics people who provide like government assistance nutrition packages in the U.S. to women and babies, and so like in those clinics, and so like it's universal, right? And so that's an individual and organizational and system level thing that everyone's commonly experienced. Obviously, things like working globally, a lot of the Gates Foundation work that we do, people have very common challenges around like conflict, right? Like literally war. And how do you deliver, mass drug administration when there's war? And so, like, that's a common conflict that's come up, and it doesn't matter what country it is. Like, there's like a common, there are certain countries that are war-torn that, like, experience that same challenge. And so I would say, like, yeah, there are a lot of common ones that do come up. And I think it's really interesting to have this kind of bird's eye view to see that there are many things that people grapple with very similarly across the world. Yeah. Any other questions? No.
Sobia, if I could just indulge, and thanks again for a wonderful talk. You talked a lot about the role of relationships and implementation,
Yeah.
which is really of interest to me, and specifically around sustainability, which is something that is key when we develop these interventions, we develop these devices. And I was just wondering if you could say a little bit more about the role of relationships and sustainability.
Absolutely. So we know that in order to be able to sustain an intervention, that you have to be able to sustain certain kinds of relationships. And that's because often when you go into the sustainability phase, you are doing things like maybe you're pooling resources to make this thing continue to happen. You have to keep applying for funding together to make it continue to happen. You start sharing jobs for, like you have certain kinds of roles that each party has to fulfill and work together in a certain way to keep ensuring that something happens over time. And something that I also looked at as well was, how do you sustain relationships to sustain an intervention, which is another level of it, right? And so this is where things like trust and power is really key. So balancing power. So sustained relationships often happen when you distribute power, when you cultivate trust, when you have, like transparent forms of governance, when you have key partnership aims that you continue to revisit over and over again. And another strange thing was this ability to be agile. So sometimes you might start a relationship doing one thing and it migrates and you end up doing other things together. But the whole point is that you're maintaining that relationship. So a key thing that happened over COVID, for example, was that there are many communities that had started partnerships around overdose prevention. This is where I used to work when I was doing public health, overdose prevention. And over COVID, they had to be seconded to pandemic response. And those relationships became sustained and translated into pandemic response. And so you can see that sustaining relationships not only helps one area, but also helps multiple areas when you can sustain relationships as well. Awesome.
Cool. I think that's it. If you could all join me in thanking Dr. Sobia Khan again for a wonderful